Ma'am, yung concerns po na nilabas niyo about the downgrading to GCQ na tataas pa yung bilang ng mga ma-infect ng COVID. Well, I'm looking at the numbers right now for NCR. Sa utilization rate, we're at 73% sa ICU beds, 63% sa isolation beds, 74% sa ward beds. That's relatively high.
Yeah.
How high do you project it to get? And napaalam ho ba ninyo formally dun sa IATF yung inyong mga concerns bago nila mapag-decision ng GCQ?
Di ba nung last week nagkaroon din kami ng press conference, no? And we already said na ang mga hospitals natin are being overwhelmed, no? Overwhelmed simply because ang daming kaso ng mga COVID-19. But I think they're still looking at the numbers like the 70% for them. And meron pang beds, no? Usually may konti pa, no? Pero sa amin kasi pag sinabi mong 70%, that is almost equivalent to really having all the beds occupied, no? So iba kasi yung pananaw namin pag dating sa ano. In fact, ang 80%, no, yung sinasabi na usual, no, pinakamataas na nare-report ng mga hospital is 80% capacity. But that 80% means lahat na ng beds, no, and even more are occupied.
Ma'am, maybe you can explain that. Bakit po ganun? Kung 70 to 80% in effect on the ground, it's already 100% occupied. Why the disparity? What does that mean po?
I think it's a disparity as to how the reporting is being done. Kaya nga, minsan nag-uusap-usap kami, i-report na ninyo yung tunay. Kasi pag hindi natin ni-report yung tunay, so hindi yan aabot sa sa ating gobyerno, and therefore they will not really be able to know na yung 70% pala na yon ang ibig sabihin nun 100% capacity. And then sometimes, alam mo, hindi ko rin alam kung ano ba ang konsiderasyon nila doon sa 70%. Kasi ang feeling din namin, baka binibilang din nila yung mga hospitals na ang mga ospital ay hindi talaga na pupunuan yung beds nila simply because there are hospitals na hindi tumitingin ng COVID-19 cases, no? Example, mental hospital, orthopedic hospital. Nobody will go there kung ikaw may nararamdaman na symptoms ng COVID. Kasi alam mo na hindi yun ang hospital na dapat kong puntahan.
Artificial po yung numbers.
Artificial ang numbers.
Which means it's still artificially low. Okay.
Yes, which will actually connote that the bed capacity is
more
low.
Pero sir, well, clearly some doctors groups, including that of Dr. Limpin in Philippine College of Physicians, they don't appear to share your confidence as far as yung healthcare capacity is concerned, and yung ability to head off another surge. Kasi for example, I was reading to her kanina the numbers ng occupancy today sa NCR, 70% for ICU beds, 74% sa ward beds, and so on down the line. Ang sabi niya, that's not really accurate. Ang sabi ni Dr. Limpin, ang sabi niya, it's really approaching 100%. It's artificially low, not necessarily through any fault of the DOH, pero baka sa reporting ng hospitals themselves. She also pointed out na baka naka-factor in din dito yung ibang mga hospital that don't really accept COVID patients, like the mental hospital and
National
orthopedic hospital. So may mga ganong factors daw po that are not really reflected in the numbers. That's why they are not that confident daw.
Yeah, right. Pero itong DOH data tracker namin, these are actually encoded by the data managers of the different hospitals. And what they encode really are the allocated beds for COVID. Hindi yung mga non-COVID. We don't consider that. In fact, the data encoding is really on time. We see this on the dashboard. And Robbie, I have to tell you that we have transformed the National Mental Hospital into a COVID facility. There are 100 beds right now there for COVID, for mild and moderate. They've been accepting not just mental patients, but rather general patients, so we can actually decongest some of the hospitals, and we're putting them there in the National Mental, because we have built a new pavilion just for repurposed for this situation. And we're
Maluwag.
also opening up on September 15 another 120 beds for moderate and severe in national and mental. This is a modular hospital. So what we're saying is that from the time that we started last year, we only had 730 ICU beds for COVID. January, we had almost 7 that. Now we have doubled this. We have almost 1,496. Now we're continually making sure that we need to put up this necessary infrastructure because that's our weakness.
Yeah.
I mean, you have to look at this with the density of the people around and the number of intensive care units that we have. It cannot accommodate a pandemic like this. So that is why we just don't allocate beds in the hospitals, but also build. And we've been building modular hospitals ever since to make sure that we can capacitate the hospitals during this pandemic.
But